Thank you, Chairwoman Eshoo. And this is a very important hearing. Today is the 11th anniversary of President Obama signing the Affordable Care Act into law. And the bottom line is, contrary to what our ranking member just said, is that the ACA has worked. Many millions of people have health insurance now who would not have had it without the ACA. I'm amazed that with the Republican efforts to basically repeal it or basically cut it back, that is still around. It shows its resiliency. It shows how people really want it, despite all the rhetoric on the Republican side that said that it, and particularly by President Trump, that said it should be abolished. But I do want to say, in response to Mr. Guthrie, that look, we don't want to cut health care for the sake of lowering costs. My concern has always been that with these junk plans that do not provide essential services, people buy them thinking that they're going to have coverage when they don't. And so I would agree with you that when you provide, and I don't know if that's what you meant, but when you provide a lot of services, because our hallmark of the ACA has been that you have to have essential services, when you do that, it sometimes costs more. But the answer isn't to take a meat axe and say, well, we'll get rid of it and sell you a junk plan. I remember going before the Rules Committee, and I love Virginia Fox. She's a friend, but she basically said at one point that there were plans that were being sold that didn't include hospitalization, and that was okay if people wanted that. But to me, if you buy a plan that doesn't have hospitalization, you don't have health insurance coverage. So, keep in mind that the answer is to make things affordable, but not in a way that eliminates services like hospitalization and mental health and some of these other things that is what we get with the junk plans. In any case, earlier this month, Democrats and President Biden signed into law the American Rescue Plan, which is the largest expansion of healthcare coverage since the passage of the ACA, and that builds on the ACA so that healthcare is more affordable and more accessible for Americans at a time when they're struggling financially and when coverage is so essential. The new law expands the ACA's tax subsidies, including for the first time to Americans with incomes above 400% of the federal poverty line. Millions of Americans will gain healthcare coverage and see the cost of their monthly insurance premiums go down. Just as an example, a family of four with an annual income of $65,000 will save $2,800 each year. A family of four with an annual income of $100,000 will save $7,000 annually. And this is a huge benefit considering this family did not qualify for premium subsidies before the American Rescue Plan. It also provides an incentive for states, a new incentive for states to expand Medicaid by increasing the federal medical assistance percentage, or FMAP, of new expansion states by 5 percentage points for 2 years. And finally, the American Rescue Plan takes steps to address disparities in coverage that have been laid bare by the COVID pandemic by creating a new state option to provide continuous Medicaid eligibility for 12 months postpartum and provides billions in additional funding for home and community-based services, or HCBSs. Now, the 18 bills that we have before us today build on the accomplishments of the ACA and the American Rescue Plan and will make a real difference in people's lives. And these bills fix the 4 years of sabotage on our healthcare system from the previous Trump administration. We're going to talk about all these, but I just wanted to mention initially, because my time is going to run out, Representative Castor's bill that will require short-term plans to comply with the ACA's consumer protections and offer comprehensive coverage. Last year, our committee's investigation found that millions of Americans are enrolled in these short-term or junk plans that offer bare bones coverage, discriminate against people with pre-existing conditions, and leave patients saddled with thousands of dollars in medical debt. These junk plans have no place in our healthcare system as they're structured today, and that's why we have to ensure they're required to comply with the ACA's consumer protection. I'm not going to go into the other bills, but I do want to stress again, we want to bring costs down, but we also don't want to allow people to buy coverage that doesn't include essential benefits like hospitalization, because without that, you don't really have healthcare coverage. And many people buy these junk plans and they're duped. They think it covers whatever condition they have, and then find out later that it doesn't when it's too late. So with that, Madam Chair, just thank you again. This is a very important hearing to say what we can do to make the ACA coverage even more expansive and less expensive in the long run. Thank you, Madam Chair.